Hi, and good afternoon, everybody. We're going to go ahead and get started because we have a full agenda, which is really exciting. Um, so, first, we will get started. I'm sure most people are very familiar with Zoom these days, but I know that I can always use some fellow reminders. So, in the webinar view, um, you will have your audio settings in the far left corner. Everybody is unmuted. And perhaps if we have enough time for Q&A, there might be an opportunity to be unmuted, but we'll likely stay muted the whole time. So if you need to change anything around there, that's how you get to it. If you need to chat, looks like some folks are already using the chat, which is great. And make sure when you chat that you select the option that says all panelists and attendees. It defaults, unfortunately, to all panelists. So if you chat something, it won't be seen by the larger group unless you select that. If you have any technical difficulties, please use the raise hand function and we will address that for you. And then we do have the Q&A box open. And primarily, we're hoping that will be used for our presentations today, especially from our panelists. And we can answer them either live or we'll type answers in. And one more housekeeping reminder is that this is being recorded, and the slides and the recording and any resources that were mentioned on the call will be available for you to access. We should be able to send that out by the end of the week. So first, I'll just do a quick agenda check. We'll get started with our partners from Child Trends, who will be doing an analysis of state and national guidance. Then we'll jump into a very brief project methodology. And then we will have our expert panel, which will feature folks from special education, Title V children, youth with special healthcare needs programs, as well as family lived experience. So first, I know that there are a lot of folks here and some folks might be new to our organization, so I will very quickly do a introduction to our organization, which is the Association of Maternal and Child Health Programs, or we like to call ourselves AMCHP. So AMCHP is a national resource partner and advocate for state public health leaders. And really what we do at AMCHP is we build successful programs by disseminating best practices, advocating on our members' behalf in Washington, providing technical assistance, convening leaders to share experiences and ideas, and advising states about involving partners to reach our common goal of healthy children, healthy families, and healthy communities. One more quick level setting is around a program that you will hear us refer to a lot today, and I know that some folks may or may not be familiar with it, and that is Title V. So Title V essentially is the nation's longest standing public health legislation, and ultimately it appropriates funds to states to do various activities. I pulled a few out here on the right-hand side of the screen, ensuring access to quality health services, promoting the health of children by providing preventive and primary care services, and then provide and promote family-centered, community-based coordinated care for children with special healthcare needs. So throughout our presentations today, in our Title V and public health arena, we typically refer to these children as children with special healthcare needs, but we know that children with special healthcare needs are essentially children with disabilities. So you might hear us fluctuate between the two terminologies, but we're going to try to stick to children with disabilities because it does tend to capture the largest population of children. So that was a very quick and dirty overview, but did want to do some stage setting. So now I am going to turn it over to my trusty colleague at Child Trends, Emily Folks.
Great. Thank you so much, Paige, and good afternoon to everyone joining us online today. My name is Emily Folks. I'm a senior research assistant on the education research team at Child Trends. Child Trends is a nonprofit research organization focused exclusively on improving the lives of children, youth, and families. And we are thrilled to be joining AMCHP and our wonderful panelists today for this important conversation. Um, I'm going to start off today by providing a high-level summary of the guidance that's already been given to schools and districts regarding services and supports for these student populations. And as many of you likely already know, most states and territories have provided some form of guidance to schools about serving these students. And we've also seen plenty of guidance come out of federal agencies and several national organizations as well. And that can be quite a bit to sort through. So we want to give a quick synopsis of what that guidance looks like at both levels, state and national, highlight any areas of agreement among agencies or topics that have been commonly addressed, and also provide a breakdown of any topics or nuances that might be missing from this guidance, and call for those topics to be given some extra consideration moving forward as schools continue to grapple with these difficult reopening decisions. And page next slide. Thank you. So, in terms of the state guidance, we've seen quite a few common themes emerge in terms of how states are guiding their districts to serve students with special healthcare needs and disabilities. First and foremost, we've seen states encourage districts to maintain consistent and frequent communication with the families of students with disabilities, as well as their individual healthcare providers and the local health agencies that can often help guide decision making about school based service delivery. School nurses and other school health staff are encouraged by states to lead the care coordination between all medical and therapy personnel that are serving the student, both inside and outside of the school. States are recommending that districts ensure that they have access to the needed PPE and other medical supplies that students require, as well as district plans to sustain that access to the needed supplies in the long term. And in that same vein, states are emphasizing the need for districts to evaluate which PPE that is appropriate for students with disabilities and special healthcare needs, as well as the staff that serve them. PPE that they're able to safely wear throughout the school day, as well as while delivering and receiving their needed services. And we've also seen many states recommend that schools make modifications to physical building infrastructure to ensure that students with special healthcare needs are not regularly exposed to students who may exhibit COVID symptoms throughout the school day, and that separate school health rooms are designated for these students to receive their own services and care. Many states, have encouraged school health staff to train educators and other building staff on the necessary safety precautions to maintain safe environments for these students and their needs. And finally, during the periods of completely remote learning, states are often encouraging districts to make accommodations for students who must receive services and care in person, including using empty school buildings or other safe community spaces to deliver those services. And for the students whose health concerns may restrict them from receiving in-person services at all, particularly during this time, states are directing districts to determine sort of alternative virtual methods for delivering services. And transitioning a bit to the national level, we've seen quite a bit of variance in terms of the scope of guidance released, as well as what national guidance tends to focus on. So we'll begin with sort of health-focused organizations like the CDC and the American Association of Pediatrics. We're seeing broad guidance for protecting children with disabilities and special healthcare needs more generally, but that often includes some school-specific content. We're seeing some organizations like the National Academy for State Health Policy release compilations or overviews of actions and innovative strategies that individual states are taking to meet the needs of these student populations. We're seeing organizations with specific expertise in this realm, such as the National Association of School Nurses. They're providing some guidance specific to the role of school health staff and school nurses in particular, who may be particularly responsible for serving and supporting these student populations. And NASN and other national organizations like the Kennedy Krieger Institute have contributed to some of the most specific guidance at the national level, which often focuses on recommendations for identifying symptoms, providing individualized care for students with health conditions that make them particularly vulnerable to the coronavirus, which would include things like asthma and diabetes. And finally, we've also seen guidance come out of the US Department of Education, as well as other national organizations like CCSSO, the Council of Chief State School Officers, to aid districts in navigating these complicated funding decisions for providing services for these students during COVID, and appropriate uses of funding streams like IDEA Part B, for example. So again, that's a lot of information to absorb kind of in aggregate. So in terms of areas of agreement, both among state and national organizations, one of the most poignant points has been the critical role of school nurses in serving these students. And as I mentioned before, school nurses are sort of uniquely well positioned to best understand both the individual needs of students, the risks that are existing within and outside of school buildings. And they also have this understanding of the greater goals of the districts in terms of bringing students back to school. Nurses and health staff are likely to be the most well-informed about processes for PPE usage, maintenance of medical supplies, and direct service delivery as well. And they also have the expertise to train school staff on creating and maintaining those safe environments that I mentioned before. In terms of the individualized student needs, as I already mentioned, among a couple of these national agencies, there's been particular emphasis on and agreement surrounding protocols for students with specific health concerns, including asthma, allergies, diabetes, as well as those who require some individual services, such as tube feedings, who may be at higher risk of COVID and whose protection requires some additional concern. And finally, like I mentioned before as well, some national organizations have brought attention to and clarified some misconceptions around the use of IDEA during COVID, including things like the appropriate use of the funds, dispute resolution procedures, and flexibilities in some of those fiscal requirements. All right, so given all of that information, now what's missing from the state and national guidance? And although we've seen various and many specific recommendations for school nurses, we also know that not all schools and districts have access to a school nurse. So in those cases, we're missing some guidance about who is responsible for protecting and providing services to these students when there are few school health personnel available in certain districts. And how can we leverage the expertise of state school nurse leadership to support districts who may not have a full-time school nurse on staff? And next, we're also missing some guidance for how to create emergency plans in case of sudden school or community spread in the virus, and how to alter those service plans for students with special healthcare needs if students need to return to school for in-person learning and suddenly have to transition back to virtual learning or vice versa. And finally, many students with special health care needs may not be able to return for in-person learning at all due to their personal health risks. And we're missing some guidance in the field for how to ensure that these students receive the appropriate and needed services remotely, sort of beyond telehealth and teleservices, because some of those options may not be accessible or appropriate for individual student needs. So with that, I will pass it back to Paige.
Thanks so much, Emily. That was a really great overview. If folks have any questions based on the information that Emily just presented, please do feel free to chat that in the chat box or add it to the Q&A. All right, so what we're going to transition to now is just a very quick presentation on what we're doing with this data that Emily just presented, and how we are trying to move things forward to really bring equity into equity in all policies to this work. So currently AMCHP is funded through the CDC, and we're working very closely in partnership with Child Trends on what we're calling a statement of principles. I've listed the overall project goal here, which is really for Title V maternal child health agencies to bridge together with state education agencies, families, and community members to make informed decisions regarding the safe reopening of school buildings. And really, our goal with this work is not to rebuild or build for the period just of the COVID-19 pandemic, but to set standard expectations. So again, we're drawing upon the best available data and research, as well as the lived experiences of children, their families, and the practitioners that serve them. really looking towards state level coordination and system resilience that will persevere through both this crisis and then those that follow. So shifting to the right side of the slide that's on the screen currently, this is a quick and dirty overview of all the folks that we have talked to in the past 2 months through a group of focus panels with groups from all over the nation. And I'll get into it a little bit in just a moment around really how we are grounding this work in lived experience. But I wanted to call attention to the wonderful folks in the field who have been really dedicated to this work. So as you can see, and how we see this work moving forward is, we know that at the state level, both health and education agencies carry the responsibility for serving all children, especially those with disabilities. And the coordination between the two is so critical. Yet there still is a need for common ground, consistent language, and stronger alignment in funding and direction. So how we see this work moving forward is with having the Title V maternal child health and children need special healthcare needs programs in all states and U.S. territories sort of be the convener of this work. And again, when I say this work, I'm talking about health and education coordination. I think the number one ally and partner in this work will be the state directors of special education. And then again, really infusing that lived experience into every single step. If we can model this at the national and then the state level, the hope is that at the district, county, city, et cetera level, lived experience, not just of families and their children with disabilities, but also of the education practitioners. So that goes beyond teachers, it reaches to paraprofessionals, school psychologists, et cetera. Then really coming in to sort of really guide the work are two groups of national stakeholders. So we have folks from the public health and disability policy side, as well as then the national education side. And, wanted to give a shout out to the American Federation of Teachers for really bringing AMCHP and Child Trends together to start these conversations in early April of this year to really think about what can we do to bring health and education together to improve these systems failures that we're all noticing. So what I'm going to do next is really showcase how we are grounding our work in lived experience. So at the start of these focus groups that we had, we gathered with a wonderful group of families who are most impacted by COVID-19 from across the nation to hear their perspectives. And at the core of that feedback that we received are the three things that are on the screen here. So what's needed is strong leadership at federal, state, local, and community levels that is delivering a consistent and unified message. The importance of partnering and engaging with parents, caregivers, and self-advocates to inform decision-making. Then the adherence to science and public health guidance. So now I'll just quickly go through kind of three areas that we pulled out from there. So talking specifically about the lived experience, here are just a few highlights of the conversations that we had. And I do want to say that not everything was negative or, placing blame. I think that could just be because we had some really wonderful individuals who gathered. But I think also that there really are some bright spots to this pandemic. And as you'll see here, we heard from some parents that they're gaining deeper understanding of their child's skills, strengths, and needs. And that's especially there with remote learning. So then moving on to really thinking about comprehensive and coordinated systems of care. I think one of the biggest challenges here is just the limited flexibility with funding streams and data sharing, and the need for guidance to allow for flexibility with other policies. Then finally, focusing specifically on the education system, the need for a flexible education system that meets the individual needs of staff and students. I can't say more how much we heard about the fact that students with disabilities, their families, and the staff that support them are really basically overall being retrofitted into these school building reopening plans, rather than being invited to the table to build the plans and change the plans when change is needed. And just a caveat to this, obviously we don't know how all families feel, but with this work and through the way that we're grounding our work in this kind of visual that I just showed, will essentially be recommending significant involvement with families in decision making moving forward. It's really key. So before we move on to our panel, I just wanted to say, one last thing. I think overall, what we're hearing again is that schools are a critical source of health services for children with disabilities, and then those with special healthcare needs as well. And it's clear that the pandemic has really disrupted this support, which has presented more significant challenges to the well-being of these individuals and development beyond teaching and learning. And looks like my PowerPoint decided it wanted to give out, but hopefully you all can see this slide up here. So what I will do now is turn it over to our very esteemed panel. We'll basically be moving, we'll be giving each panelist about 10 minutes to discuss their experiences in being at the center of these conversations. And we're really appreciative of the folks who are here today to really focus on, we'll look at guidance and comments from the national level, the state level, as well as the local level. So without further ado, I'll turn it over to our first panelist, Ms. Valerie Williams, who is the Senior Director of Government Relations and External Affairs at the National Association of State Directors of Special Education. So I will turn it over to you, Valerie. Thank you so much.
Thank you. Can you hear me, Paige? Perfect. Okay. First of all, I want to thank AMCHP and Child Trends for the invitation. I greatly appreciate it. I might be talking a little bit fast. I have a ton of information I want to share, and my time is limited. I actually have a stopwatch so that I can keep up with my time and not go too far over. NASD, the State Directors of Special Education, we are an organization, membership organization. In every state and territory, there is someone in charge of IDEA implementation in special education, and they are our members. We have a ton of notes. We have a multitude of concerns in relation to COVID and what's going on with our students, but particularly in relation to those with the most significant disabilities and those with underlying health concerns. We have been pleasantly surprised that our members are at the table for the most part when decisions are made at a state level. So when they're talking about what's been going on, what should be going on, what things should look like when buildings reopen or if they're having to open and close, our members are at the table. And even though we were and continue to be extremely concerned about lack of funding, which I'll go into in a little bit later, and we have not gotten any IDEA specific funding. Even when we got funding for education, we were heartened that we've been in contact with the state chiefs and the governors on a weekly basis. At one point, up until a month ago, it was twice a week. And they have been coming in with questions about students with disabilities, certain things that need to be done. We've been solving problems in real time. So the students have not been forgotten, and that is something that we are we're glad to hear, and we kind of keep that in the forefront of people's minds as they're making decisions and moving forward. Do the decisions that they're making work for all students? Some of the concerns that we have, broadly, the schools are being asked to deal with a public health crisis. Our systems are not designed to turn quickly and do things differently. It normally takes years and years before any changes are made in the education system. And we've literally had to turn things and do things differently overnight. I know at my son's school in March, they decided on a Thursday that Friday would be the last day of school, and on that Monday they were closed, and they've been closed ever since in terms of physical buildings. So things have happened very quickly, and everyone is having to adapt and try to fly the plane while they're building the plane and make changes. And it's been interesting to watch. I'll go into later some information about some of the creativity that we've seen and how things that we ordinarily would not have seen in the public school system happen so quickly. Some of our other major concerns as an organization, we are concerned about the lack of a federal response to the health crisis. And the result has been that states have been left to work in a patchwork fashion to try to put together plans and procedures for everything. So the information that specifically that the Department of Education put out pretty much just reiterated the law. It didn't go into a lot of detail about how to deal with this specific situation because there's no playbook for what we're dealing with right now. This is all new. There's no template. No one has ever been through anything similar to this before. And the lack of guidance has not been helpful. So states are doing a lot of talking to each other, piggybacking off of each other. If one state has developed a policy or a procedure for something, other states might pick that up and tweak it a little bit. And because each state and each district is different, but there's been a lot that had to be developed by the states to deal with what's going on because there was no information that was really given to support what's going on right now. So that has been problematic. The pressure to reopen physical school buildings because, and I make that distinction constantly because school is going on, school has been going on, kids are still learning, but physical buildings are not open in a lot of places. So there's been a lot of pressure to reopen school buildings and particularly for students with significant disabilities, as well as English language learners, those that are homeless. And the pressure is coming from all over. There is political pressure. There is pressure from parents who are not trained educators and they never had any aspirations to be, and now they find themselves in that position, as well as parents who are not able to work if they're at home and they need to leave the home to go earn for their family. So all of these things have put us in a place where there's a lot of pressure to get kids back in the buildings. And in all honesty, there aren't any really good answers for how to do that. A lot of decisions are being made based on either political pressure or based on risk tolerance, not always being made with health and safety in mind. And it, like I said, it's a patchwork. So that is problematic. Our organization's stance is that if school is not safe for everyone, it should not be safe for anyone. Students with disabilities sometimes are used, and we believe they cannot be used right now as canaries in the coal mine. So we find it problematic to send back students with disabilities with no processes, no procedures in place, kind of send them back, see how it goes, and if it works well for them, maybe we'll send some other students in. That is not the way things should be operating. If districts do want to reopen in smaller numbers, we need plans in place for what to do on how to open. If you need to close again and then reopen, what do those plans look like? We believe strongly that there should be federal funding to support our districts and our states as they reopen, because there are a myriad of additional costs that we did not have pre-COVID. So say, for example, there's going to be additional staff that's needed. It was already mentioned earlier that a lot of schools don't even have a school nurse. And so the school nurses are going to be needed as we get back into the physical buildings, not just for all of the work that nurses typically did before, but you're going to need a liaison to the local public health department and a lot of other things that honestly we did not have to deal with pre-COVID. You're going to need additional custodial staff for the cleaning, additional funding for all the sanitation that needs to be done, for transportation, for PPE. There is a list of costs that the school systems do not have funding for right now. And we strongly believe that federal funding should support that. There was already a shortage of educators and related service personnel. That's only going to be exacerbated and get worse. That's a huge problem as we see it. Something that impacts all students is the homework gap and having access to Wi-Fi, having access to technology broadly, and specifically in relation to students with disabilities. Under IDEA, our students are mandated to receive a free and appropriate public education in the least restrictive environment. And so in trying to deal with the health crisis in the school buildings, a lot of the time for health and safety, you have to have a certain number of students, they have to be spaced apart, and you don't want the kids moving around a lot. You want the same kids to be staying in the same classrooms with the same teacher for health and safety reasons. But the problem with that for some students is that if they are in and out of different classrooms during the day, say a student with disabilities might be in a general education classroom with their typically developing peers for part of the day or for certain subjects, that might stop based on health and safety, but that is a violation of least restrictive environment and faith in the IDEA. That's a problem as well. We have found broadly that districts that were doing well providing education to students with disabilities pre-COVID are being very creative. They're finding new ways to do things, and things are not perfect, but they are improving. Likewise, we have found in districts that had problems pre-COVID, they are having even more problems now. And so what we're seeing is that COVID has exposed all of the inequities that we all pretty much knew were there already, but it's really put a magnifying glass on them. And we believe our role at NASD to be a number of things. One is to, at every turn, make sure anyone making decisions about our students has not forgotten about them. So they might be thinking about education broadly, students broadly, but don't forget there are specific populations that require specific things, and that must be considered while you're moving forward making your plans. We also believe that we are there to provide clarity. On our website, nasd.org, under resources, I believe, there are 3 or 4 issue briefs that we have put out in relation to, as we got questions from the field, from chiefs, from educators, from a variety of other people, we put out a couple issue briefs to address those concerns. We have done a ton of press, more than we would ordinarily be doing, because we want to keep the issues of our students in the forefront during this time. So we've talked to the New York Times, the Washington Post, CBS Evening News, Ed Week, just all of the people that you would expect in the education space and other people, because as things have rolled out in our school system and trying to deal with COVID, everyone is concerned about what is happening with students with disabilities. Thank you, Paige, for putting that link in there. We have always had a lot of partnerships. We've created additional partnerships with people that we didn't have partnerships with before, because we believe this is a time for creativity and collaboration. That's the only way we're going to get through this is together. And so an example of that is we developed a partnership with the Infectious Disease Society of America, just based on the public health crisis and needing to have some of our questions addressed. And I think it was eye-opening for all of us to find out the infectious disease folks, what they knew and did not know about education, and also what we did not know about health in relation to this crisis. So We have a lot of partners that we wouldn't have linked arms with ordinarily, but we're needing to do that. And we're talking to a lot of our partners significantly more often than we did before, because this is a fast moving train. And we've already had conversations with the transition team about our priorities, not just broadly in relation to education or special education, but what's going to need to be done to recover from COVID. Because we are clear that when all students return back to the school buildings, we're going to need to recover from COVID, and then we're going to need to pick up and move forward. And that's going to take a yeoman's effort. It's going to take all of us working together and being clear on what the issues are and being willing to make quick decisions and move things forward, because a year or two in the life of a student is a long time. So those are just some of the quick things I want to go over. And I think I can pass it off to the next panelist.
Thank you so much, Valerie. Really appreciate that. So yes, next up we will have Heather Smith, who is with the Kansas Department of Health and Environment, is the Director of Special Health Services, and serves as the Title V Children Youth Special Health Care Needs Director. Thanks, Heather.
Hi, Paige. Thank you so much. And I want to echo what Valerie said around thanking AMCHP and Child Trends for these conversations and for the ongoing discussion around how we can assure our families of children with special health care needs are really integrated into the decision making as we move forward through this pandemic. For those that aren't familiar with Title V special health care needs, we are a state-run, in Kansas, at least I should specify, in Kansas, we have a subset of population services available to children and families with special health care needs. However, we really look at all of the special health care needs systems of care as we work through the services that we offer and trying to make connections and collaborate across the state. And so I think some of the things that what has really stuck with me after some of these conversations and following a previous conversation we'd had, we reached out and started holding some focused conversations with families, asking them what have their experiences be and what have their experiences been, and what were they involved in as some of this was happening at the community level. And something that really has stuck out for me, and I think is really out there for most people, is that families are resilient. We know this, we've known this forever. Families are amazing at adapting and rolling with the punches and adjusting and pivoting when necessary to address the needs of their children. I think Paige indicated earlier that there's that same need, there is a need for this same level of flexibility and adaptation in our education systems to meet the needs of children, especially those of children with special health care needs. And I think it's pretty clear for me, at least coming from a Title V perspective, that our systems have done a really remarkable job of trying to pull together, rallying to support families, and they've really done a pretty good job. I do think also, I think Valerie, I'm going to borrow her word when she mentioned that the systems had to create their own playbook in this work, and that they were going without a guide, and that families were also going without a guide in a lot of this. And the states, especially states that didn't receive strong guidance, well, all states, of course, didn't receive strong guidance in how to navigate these situations. But even within states that state education departments were only able to provide recommendations and not necessarily specific strong guidance, or were not allowed to require certain things to be done, that made it a little more challenging, I think, for some of the communities, and families they definitely felt that. And I think one of the things that really came to mind for me when we were talking with the families is families' number one thing that they said to us was, we just simply wanted to be informed. We wanted a stronger communication, and we needed to understand what this was going to look like for our families. And I had a couple of families even tell me, thinking about the last question that Paige posed, is, do we feel that the needs of children with disabilities have been given proper consideration in the discussions around school reopenings? And I think our special education systems have done a phenomenal job of trying to address all the needs that they could. I think they have really rallied to support families, but I do think families didn't necessarily feel that at their level. And I think something that we as Title V can offer to our state counterparts and to others across our communities is an opportunity to connect with families at a different level. And maybe come in as a valuable resource or as an ally when it comes to figuring out what our next steps look like and helping families, provide opportunity for families to have a voice in the work that's happening and in the decisions that are being made. I think, again, some communities did a really remarkable job of that, and then others, they were doing the best that they could. And I think that's something that's been identified through a lot of the work that AMCHP and Child Trends have been working on as well. So I think my time is about up, which that went very fast, Paige. But I do really think that something from a Title V perspective is just really being able to connect with those that are providing services to families, in addition to the school system, and connecting with those community resources, connecting with the state programs, and connecting with the providers, and especially in a medical and health related service area. We had a lot of families that indicated their services were dramatically reduced and decreased when they went to virtual learning, but without necessarily a pathway or avenue to understand how do they rally from that? How do they restore those services? What are the opportunities for them? And so I think that's something to consider, in Title V. I think could be a strong partner and ally in a lot of that work. So I think it is time for me to pass it along to Dawn, and I'll let Paige do those introductions. But again, I really appreciate the opportunity to be involved in these discussions, to engage some of the families that we have in our state that have really experienced some of the both positive and negative impacts of what has happened with virtual learning in their world, and to help us understand a better way to move forward and make sure families are involved as decisions continue to be made.
Thanks so much, Heather. Really great to hear about the work that you all are doing, to hear from families. I think that's exactly, I think, what where we want this work to go. So really great to hear. So next, I will turn it over to Dawn Bailey, who is the Family Engagement Specialist at the Arizona Department of Health Services Office of Children's Health, with a focus on children and youth with special healthcare needs. Dawn?
Thank you, Paige. Can you hear me okay? Great. Yes, so I, again, want to also thank AMCHP and Child Trends for the opportunity to be part of these discussions and to keep pushing this forward. I think that what Valerie shared and also what Heather shared, we can echo here in Arizona as well. We know that this came about rather quickly early on this spring for a lot of our systems and for our families. I think a lot of our state systems did a really good job at trying to adapt quickly to meet the needs of our families with our Medicaid services, our home and community-based services, and education services as well. I do think, though, as we looked at reopening, I think we could have done a better job, like what Heather had mentioned, about really engaging with our families about what education needed to look like for our families of children and youth with special health care needs. We had some guidance at our state level. In our state Department of Education can only offer guidance. Our districts can pretty much make their decisions within their districts. And so that can vary from district to district of how they are going to look at doing policies and protocols around reopening and services. And so sometimes that can be really hard for our families to navigate. We really struggled, I think, when schools were reopening. the decisions were made for our families as to whether or not their kids would be returning, rather than our families being a part of those discussions in a lot of cases. And then that obviously negatively affected the type of services they were able to receive, whether telehealth or in person. And then we had, I think, some unintended consequences with our home and community-based services with our Medicaid program for a lot of our families, because there is a lot of crossover with our systems of care. So I think, like Heather said, our families are resilient. We often find ways around those. We do the best that we can to adapt. And I think that our families can offer a lot of valuable insight on solutions as well. So going forward, I would really like to see the opportunity of incorporating family input into next steps. And as we continue to have to adapt, we here in Arizona are kind of going back and forth. We closed, we reopened, limited, fully. We have some districts going back to online, some staying hybrid. So we're kind of in this constant state of fluctuation, which I think can be really challenging for our families as well. And so I think continuing to make sure that we are engaging, having those conversations, informing, letting our families be part of the solution as we move forward is going to be key. And I think what Valerie mentioned as well is looking beyond your traditional stakeholder group and thinking about additional partners that need to be at the table. I would really like to see more representation with our statewide Department of Education group, looking at guidance to be more inclusive of children and youth with special health care needs. And I think just we continue to work with our F2F here in Arizona to help our families advocate for themselves and work with their districts. But this is going to be a long road for our families. And I think the more we can work with them, the better we can serve these children going forward. So I think, I apologize, I have my daughters here too, so multitasking. But I think, Paige, I'll throw that back to you and have it for our last panelist. Thank you for the opportunity to share.
Thank you so much, Dawn, and thanks for demonstrating the multitasking that so many families are doing these days. I really appreciate you making the time to speak. So finally, we'll wrap it up, last but not least, with Lakeisha Hines. She's the founder of the Tampa, Florida-based family-run nonprofit Support for Caregivers. So I will turn it over to you, Lakeisha. Thank you.
Hey, good afternoon, everyone. Can you hear me well? Awesome. So I will follow suit, man, and just say thank you so much, AMCHP and Child Trends, for recognizing the importance of the family voice, the parent voice. That's definitely who I am here trying to represent today. Just wanted to touch on a couple things. Honestly, most of what Valerie said, what Heather said, and what Dawn said are things that I was going to mention. So I, just want to say kudos to you guys for really understanding what it has been like for a lot of our families. The schools being closed was devastating for families. And I do believe that a lot of states, mine in particular, opened up too soon. I do understand why, but I do believe that our state reopened too soon and schools just factually were not ready. There definitely needed to be more collaboration between the public school system, not even public, school system, because that incorporates private as well, but the school system and public health agencies, because we could have gained a lot of insight from working with our public health professionals. So with schools reopening, parents were fearful. They didn't believe that schools were ready and didn't have solid plans in place. I feel like specifically in my district, we did the best, we could do. I do feel like everyone, again, there was no playbook, using Valerie's words, and really having to write the playbook as we're going through was challenging for all. So I think everyone understands that, but it just made it very difficult for families to feel comfortable sending their kids back to school. Parents had concerns about keeping them home because they weren't going to have access to their services. And I don't know that parents were informed or fully understood that keeping their kids home and doing e-learning meant that they wouldn't have access to the services that were on those 504 plans and those IEPs. Parents had concerns about nurses and them going to various sites, different school sites. Maybe they work in a hospital or another healthcare facility and they work part-time at the school. So parents were concerned about them potentially bringing in germs, of course, to the schools, and they're on the front lines and potentially having COVID, being asymptomatic and bringing that into the schools. We do know that a lot of the school nurses are there for tube feedings, and I mean there's interaction that has to happen with the nurses. If the kids have to have specific medications, only the nurse can distribute it. So again, we know that with our kids that are more vulnerable, they have to have that nurse contact. So they definitely were concerned about that. Again, having their kids at home and not getting those services. Teletherapy was there, Zoom was there, but we all know every kid is not a candidate for teletherapy, telehealth. And Zoom was not accessible for all. There are a lot of parents who struggle with technology. And I mean, there's still some parents that are using flip phones, which is crazy to me, but they're still using flip phones and just, again, have no clue how to even access a Zoom or set up a Zoom account or do anything like that. So trying to do that with their kids so that they could continue working on those educational goals has been challenging for a lot of families. Our particular district utilized a system called Canvas, and that's where a lot of the coursework was being utilized. They were using Google Classroom and just different programs to be able to assist kids who were e-learning. And again, parents were not familiar, they weren't comfortable, they were feeling overwhelmed, they're stressed out. I mean, it just was a lot. So we know for a fact there's going to be regression from our kids who chose to e-learn. We know that it's inevitable, that is definitely going to happen. So parents are definitely concerned about that. So with support for caregivers, we try to work with families to advocate for them, to be their voice, to offer resources and support. And we just felt like the needs of children with disabilities were not given proper consideration. We felt like, and forgive me, I don't remember who said this, but basically our kids with special needs, our kids with disabilities were kind of lumped in with the typicals, right? And so generally we have gotten a consensus from of families that we work with and that we interact with, that they just in general didn't feel as if they were considered in the decision making. And even parents of typical children have said that they didn't feel like they were a part of that decision making as it pertained to schools reopening and what those plans were. Someone else mentioned, one of the other panelists, and I apologize, I don't remember who said it, but the parents had to become teachers. And again, we didn't sign up for that. That's not what we wanted. That's why we sent them to school. Otherwise, we would have been homeschooling. And, you have parents who, again, are now having to become teachers for their kids. And they've never even had to work on a homework assignment with their children before. So completely lost about what that looked like, trying to work with, again, their child at home who's e-learning and who may already be having some challenges with reaching their educational goals. So that was a challenge as well. My understanding of Title V is that it's all about promoting informed parental choice and innovative programs. So again, Were parents informed? Did they feel as if they had all the necessary information to make appropriate decisions about whether or not to send their kids back to school? A lot of families felt stuck between a rock and a hard place. If I send my kid to school, I'm terrified that my most vulnerable kid, because for me, I have 4, and my son with disabilities is the most vulnerable. But if I don't send that kid back to school, again, he loses services, there's regression and all of those things. So they really felt just stuck and torn and not sure what to do. And then as far as the innovative programs, the question is, where are they? Has anyone considered putting more funding into our hospital homebound programs where we could get more teachers that could potentially serve more students who are at home, especially the ones that are most vulnerable, our kids with trachs, our kids who, again, have weakened immune systems, those kids who have autoimmune diseases, those kids who are asthmatic and need the feeding tubes and do have the trachs and that are more vulnerable. What can we do to support those families to make sure that they're not losing all the gains that they've made? And so I'm not sure where my time is right now, but I just want to leave you with the 4 C's that I think are most important for our families, and that is connect, communicate, collaborate, and create. We needed to connect, which is what you guys are doing today, Child Trends and AMCHP, connecting all of these individuals to try to work toward a solution, and we're all working on a common goal. But I do believe our districts and our public health, our school systems and our public health agencies needed to be connecting, but also those 2 organizations connecting with families. There definitely has to be communication. Open lines of communication at all times, no matter what. There is no excuse for not communicating and giving parents the information that they need to make informed decisions. And collaboration, again, that's what we're doing today. Definitely families want to collaborate. They want to work toward trying to provide solutions for their children. And last, create. Through that connection, communication, and collaboration, we can create some systems that work. We can create programs that work. We can create solutions that work and that will, again, support not only our families, but our children with disabilities. And at the same time, taking care of the mental health of our families, which includes not only our students, but our parents as well, to make sure that we're promoting healthy families. So thank you again, you guys, for your time. I sincerely appreciate it. And I'm looking forward to future work.
Thank you so much, Lakeisha, and wonderful to end with the 4 C's. Thank you for that. I think that's a really great closing piece for everybody. So we only have a few minutes left. We did have a question or 2 in the chat box. So there was a question about what were the challenges with the home and community-based services beneficiaries in Arizona, and Dawn answered that in the chat box. And as well, Valerie entered a really thoughtful comment in the chat box as well. So please do check that out. I really appreciate everybody for being here today. My slides are still frozen. Not really sure why that's happening, but again, technology, you can prepare as much as you want to, but it will always have a mind of its own. So one thing I just want to ask folks, and this will come up on your screen once you leave the webinar, is to fill out our evaluation survey. I just copied the link in the chat box as well. We'd really like to hear your feedback, and not only your feedback, but what thoughts you have for this work, and if you want to be involved moving forward. I'll close just with updating you on where we are with this. So as I mentioned, we have gathered a number of groups, including education practitioners. And so now we are taking that information and again, grounding it in lived experience and coming up with what we're calling our statement of principles. We'll be convening another set of groups in the new year. still ironing out how that will look. This work is one of those things that develops as you go and changes day by day based on what families and individuals are experiencing. So we're being flexible with that. But all of you are on our email list now, thanks since you joined the webinar. So we'll be sure to keep folks posted once the final resource is released. And again, the goal of this statement of principles is again to bring together those decision makers at the state level to model that health and education coordination, so then it can trickle down to district level, local level, city, county. You know, it's different in every state and territory, and we really hope that that trickle down will really make a lasting impact on families. And again, with that strong, you know, and necessary involvement of families as well as education practitioners. So it is the close of the hour. That was a very fast hour. Thank you all so much again for being here. Thank you so much to all of our wonderful panelists. Couldn't have done this without you all and your experiences. And I hope that everyone continues to stay well and safe and healthy, and that you have a nice holiday season. Thank you all again, and we will be in touch with more. And we'll share the recording and slides. Thank you.